26 clinical trials with 14 Indian clinical trials, and it is comparable. Today when we talk about a new drug, do we say it's superior? The statistical terminology, it is as good or it is non-inferior. So that's what I'm saying, it can be compared to a GnRH agonist, and the dose is 10 milligrams to 25 milligram, chota sa dose hai. And the studies have all shown that there is a decrease in the fibroids, as we'll see some of the studies as we're going along. And because it shrinks the fibroid, it reduces the mean menstrual blood loss and thereby reduces the pain as well as the urinary symptoms if it was in the anterior side. So now let's see what is the action. Mifepriston is an anti-progesterone. So number one direct attack site is fibroids. So वहाँ पे जो BCL बढ़ रहा था, this is reducing the BCL2, so it induces apoptosis. It reduces the epidermal growth factor, so it decreases the angiogenesis, and here it increases the tumor necrosis factor, so it inhibits cell proliferation. So triple action on the target one, and decreases the fibroid size, volume, shrinks, and thereby reduces the symptoms. The target site 2, the pituitary, the master gland. It inhibits ovulation. So because of that, there is amenorrhea that also helps the hemoglobin to get better, and the fibroid does not get its estrogen and progestogen. Site number 3 is directly on the uterus. What does it do? It reduces the uterine blood flow and helps to shrink the fibroids. And target site 4 is the endometrium. Direct suppressive effect, as a result of which the mean menstrual blood loss is lesser, and even if there is endometrial hyperplasia, this is completely reversible and does not result in a blood loss. So this is an action which is summarized. We don't need to go through this slide. But now let's look at some of the Indian clinical trials. AISOG 2016, there was a paper which said that Mifepriston relieves the fibroid symptoms, reduces the sizes. The same thing was suggested by ASRM 2009, and then 4 years later, again in 2013, low dose, they started talking about low dose. So now let's see, this was the first study done by Dr. Alka Kriplani at AIIMS, and this was under the banner of Jessie. Jessie is the Gynec Endocrine Society, where she suggested that this is a good option because by the virtue of the studies, it was a short study for 6 months, and they found that in women more than 40 years of age where you did not want fertility, because that was the age group that they chose, there was a decrease in the size of the fibroids, and thereby it reduced the bleeding. They also had done a study on the ulipristal, but at those days ulipristal was not available for general use. Then there was the Cochrane data.